Good morning all, my name is Dr. Parul. I am from Chandigarh group of colleges. So today we are going to study about the composition, responsibilities and procedures of IEC and IRB. First, what is an IEC or IRB? IEC IRB stands for Institutional Ethics Committee or Institutional Review Board. So what is the use of this Review Board and Ethics Committee? It is an independent body which consists of scientific, non-scientific members that are basically responsible for ensuring that the rights, safety and well-being of the participants are well protected in a clinical trial. So they are also responsible for reviewing, approving and providing continuous review of amendments, any additional documents that is submitted after the trial has been initiated. So what is the composition of IEC IRB? Any member who is a member of IEC IRB should be equally qualified in medical scientific aspects. So it is recommended that IEC IRB should have at least 5 members, out of which 1 member should be from non-scientific area, 1 member should be from scientific area. Only those members who does not have any conflict of interest should vote for whether the protocol is approved or not. So no clinical trial or bioavailability study could be conducted before any of its 5 members. These are the main 5 members that are present, that should be present to maintain the quorum. These are the medical scientist, preferably a pharmacologist, a clinician, a legal expert, a social scientist or a representative of an organization, a layperson. Layperson is very important because layperson sees that whether the document is according to understanding of a person who is not from the medical background. So the ethics committee should have minimum of 7 members and a maximum of 15 members, which include medical, non-medical, scientific and non-scientific members. So out of all the members that are present in the ethics committee, 2 members should always be non-affiliated. One is the chairperson and one is layperson. Non-affiliated means that they should not be from the university or the organization which have this ethics committee. Then this ethics committee, there are 2 types. Each institution can have its own ethics committee, that is independent ethics committee. If the organization does not have an ethics committee of its own, so in that case within 50 km of radius, the ethics committee which is present could be act as an ethics committee for that institution. So what are the role and responsibilities? The ethics committee is responsible for safeguarding the rights, safety and well-being of the participants that are involved in the clinical trials. The IRB should review the following documents. First is the protocol. The protocol have all the information regarding what is the study about, what are its inclusion and exclusion criteria, what are the tests that are to be conducted in the clinical trial. Next, the informed consent process. Informed consent form is basically a form in which the participant is given all the information and participant signs that he is voluntarily participating in that clinical trial. Written information provided to the subjects, that is also known as patient information leaflet. Investigator brochure. Investigator brochure contains all the information regarding the drug from its processing, manufacturing till the animal data that is being conducted. Available safety information regarding the drug, if any adverse event that has been happened in the past or not. Information about the payment and compensation. Payment and compensation is also a very important part of clinical trial. The subjects are responsible for compensation in case of any adverse event that have happened to them during the clinical trial because of the investigational drug. The investigator, all the members in the clinical trial should have proper qualification, proper GCP, MRC certificates. So the IEC IRB should review the proposal, that is the protocol, within a reasonable amount of time and clearly identify whether they have approved the document, whether they have disapproved the document, or there is also a case where they have give partial approval, that is the investigator is asked to do some modifications, after that the protocol will be approved, or they could also terminate or suspend any clinical trial. IEC IRB should always look for that the investigator who is conducting the clinical trial is qualified or not. IEC IRB should also conduct continuous review throughout the clinical trial, preferably once in a year is mandatory. IEC IRB could request more information if the IEC IRB thinks that the information provided is not up to the mark or any additional information could be given that could safeguard the participants well, so that information IEC IRB could ask. IEC IRB should also review both the amount and the payment method used in the clinical trial. IEC IRB should ensure that the information that is given to the subjects regarding the method, amount, schedule of the payment or any information that is written in the consent form protocol is followed or not. When a non-therapeutic trial is carried out, if in case when there is a subject is illiterate or a subject is vulnerable patients are there, so a legally accepted representative is present. Without legally accepted representative, the informed consent form could not be signed. So what are the procedures? IEC IRB should establish their documents in writing and follow its procedures. So these are some of the procedures. They should determine their composition, the authority under which it is established, schedule and notify its member when the meeting is take place, conduct initial review as well as continuous review during the clinical trial, determine the frequency of review, that how many times the review will be conducted, as we have studied that once in a year it is mandatory. Providing information to regulatory requirements and expedited review, providing their opinion whether it is approved, disapproved, specifying that no subject should be enrolled in the clinical trial or should use any documents from the clinical trial which is not approved by the ethics committee. Specify that no deviations, there should be no deviations from the protocol. If there is any deviation, it should not be conducted without the prior approval of ethics committee. Ensure that the ethics committee notify their members that what are its trial related decisions and what is the reason behind their decision. If they had disapproved the protocol, then what are the reasons that they have disapproved, what they did not understand. Specify that the investigator should promptly report to the IEC IRB in the following cases: if there is any deviation from the protocol, if there are increased risk, if some new information is obtained which specifies that there is increased risk to subjects, in that case EC should be notified on priority. All the adverse drug reaction, whether they are serious or not, should be notified to the EC. New information that can affect the safety and well-being of the participants in the clinical trial should be promptly reported to the ethics committee. IEC IRB should retain all the records. Now it is 25 years. For 25 years the IEC IRB should retain the records of all the clinical trials, all the decisions, all the documents that are present in the clinical trials, minutes of the meeting, correspondence. For the IEC IRB could also be asked by the investigator, sponsor or regulatory authority to provide the written procedure as well as member list. Thank you all. This is my lecture for today. I hope you understand. Thank you.